We are live now. Welcome, welcome. Happy Wednesday and welcome to Back Talks with Dr. Sean McWilliams. We are a community and a family that is growing every week and being a resource for you or your loved ones, for people if they're suffering with back pain, bulging discs, herniated discs, spinal stenosis, facet arthropathy, and they're just fed up with perhaps the medical profession, that the injections, the medications, the ablations, the epidurals, and they're still not getting better. Maybe even a microdiscectomy or a fusion. So we're here to help bring you fresh information every single week where you can come and answer questions, ask questions and get them answered, and feel like you have a resource of a doctor to be able to help guide you and bring you some of the latest information so that you can heal your back naturally. So let's talk about it. So what are we going to talk about today? Well, we're talking about another vehicle that people have a tendency to use, and most of your orthopedic surgeons or spine specialists, minus your neurosurgeons usually, are going to be offering you as an option, and one of them is going to be facet injections. So let's talk about what facet injections are. And if you are here with us, please say hello. Leave me a comment. Sometimes with YouTube and Facebook, sometimes you got to log in twice to get on the live. It's not perfect, unfortunately. So if you send me a comment and you don't see a response, probably because I didn't see it. So please just kind of refresh your browser, and it'll usually work for you. So what are facet injections? I want you to understand the benefits of them, and there are some benefits of facet injections. I want you to understand the risks of them and your other non-invasive options, okay? So why do I know about this? Well, I've studied a lot about it, and also this is one of my very good friends. I have been in their clinic. I've been in other surgical center clinics in my community where I go in and spend a few hours, a half a day with them, and I get to sit right next to the doctors doing facet injections and ablations and other procedures, epidurals. So I see these things firsthand, and I get to talk to the doctors in between visits as well, asking them, hey, would you do this if this was you? So I want you to know that's where I get my information from, plus studying. So but my buddy here is amazing. He's incredibly good at it. So if I was going to send anybody, and I have sent people for facet injections, just so you know, he's definitely one of the ones that I would recommend. So what is a facet injection? Well, it is a tool that most of your spine specialists, pain management specialists are going to use to distinguish the difference between facet joint pain or disc generated pain. So why do they need to know that? Well, because unfortunately they don't have a lot of options for making and helping you feel better if you have discogenic pain without starting to do some pretty invasive stuff. So they want to see if it's the facet joint. And so what are we talking about when I'm saying the facet joint? So let's take a look here. I'm going to show you a close-up of this disc, if you hang with me here. All right, so if you've been with me for any time, you remember, just trying to get this super focused for you here. There you go. You remember that there's two sources of back pain. The disc is one of them, and that is this structure here, and we're not really going to go into it today, but this is going to be your number one source of pain. And then number two is the facet joint. And when I say the facet joint, what we're talking about is this joint right here, and then this one right here. That's your facet joint. And when the joints are smooth, like you see in this model, it's pretty atypical that people are going to have pain. If they start to become arthritic, and let me show you the difference here. So you can see the difference right there is the facet joint, and you can see how bumpy it is compared to the other one. That's usually when people are going to start getting discomfort or pain because of the facet joint. So all that being said, let's go take a look at it. So they're going to do is they're typically going to inject the facet joint, and what they're looking to do when they do this is they want to inject a pain medication into this area. This is your facet joint right here, all right, with this needle. that you see right there. And what they want to do is they're going to be putting in some sort of steroid, usually, and also some sort of pain relieving medication to numb these nerves. They're usually going to do what's called a medial nerve branch block is the number one thing, because it's easier to get to, and it branches off a little bit, so it usually can give people pain relief. And the other thing that it can do is it can then guide them in letting them know if the pain is typically coming from the facet joint. And if it is, then they usually know that's usually the source of your problem and pain, and then they're going to try to go and manage it. Stephanie Trinkle, happy New Year to you again, and happy Wednesday. Hi Marisa, great to have you here as well. So can this be helpful? It can. You know, if you're going to go the surgical route, or if you're in excruciating pain, this sometimes can give you some pain relief. Most of the time, I'll let you know, the people that I've seen that have gone and done it, I just sent one of my patients for it a couple weeks ago. She's had multiple ones done, zero pain relief. And so, but it sometimes is worth a try if you're just dying in pain. So are there some complications that can happen to it? Well, there is. You know, you're injecting something with a needle going through your skin, so there are chances of you getting an infection. You can get muscle weakness if you hit one of the motor nerves. You can have allergic reactions. You can have aggravated pain. There can be nerve damage. You can damage the nerve if you hit the nerve with a needle. And thanks, Stephanie. Happy New Year to you too, and Marisa. Aw, that's so nice. I hope you're doing great, Stephanie. Always great to have you here. I missed you the last few weeks. You can also get bleeding, and you can get paresthesia. That's numbness. So things you really don't want. So do you have other options beside this? Well, yes, you do. In most cases, spinal decompression therapy can be very effective for reducing anatomical pressure that leads to inflammation around that area. So if you've been with us for any period of time, you may have remembered this gentleman, Dr. Dennis McClure. Dr. Dennis McClure was a very famous neurosurgeon. So you know, you go like orthopedic surgeon, spine specialist, neurosurgeon. So these guys are smart, you know, and not only do they do surgery on the spine, but they also got to learn brain surgery. So, you know, that's some really specialized knowledge and some really special people. Oh, Stephanie, I'm so glad you're doing better. It's so nice. Thank you for sharing that with me. I'm so glad that I could help you. You deserve to feel better. You're an amazing person. So let's see what Dennis McClure had to say about this other non-surgical option, even though he was a neurosurgeon. So he said, patients with back pain usually present to a neurosurgeon or spine specialist with an abnormal MRI, while the referring doctor tells them that they had degenerative disc disease, also known as DDD, causing their pain. He says, throughout my years of practice, those patients with back pain want to know a few things. They want to know, number one, why do I have back pain? Number two, what are the causes of it? And also, how can we effectively treat their back pain? And look at this, without surgery. That's what his patients ask him. How can we do this without surgery? He says, in addition to improving pain, another goal of theirs was to improve flexibility, as well as quality of life in the safest and most effective manner prior to recommending more invasive procedures due to degenerative disc disease. That's what his patients wanted. I think a lot of, almost everybody that's here is part of our group. That's what they want as well. They don't want invasive, dangerous procedures. They want non-invasive, safe procedures. Dennis McClure said, it is a misconception by the public that surgery fixes a person's back pain. If that were true, we would never see patients with failed back syndromes. And that is an ICD-10 code right now, failed back surgery syndrome. And I would bet that Tiger Woods is in the failed back surgery syndrome because he's had 5 of them already, and the poor guy's still in pain. So Dennis McClure continues, in November of 2003, I introduced IDD therapy into my neurosurgical practice. IDD therapy is a non-invasive spinal rehabilitation therapy developed by Norman Shealy, MD, PhD. Who's Norman Shealy? He was a former teaching fellow in surgery at Harvard School of Medicine who came up with this idea. IDD therapy is a therapeutic treatment, and get this, therapeutic treatment for the lumbar or cervical intervertebral discs and facet joints. You get both, you get 2 for 1 with this therapy. A course of treatment is approximately 6 weeks with 20 sessions of 25 to 30 minutes spread over approximately 6 weeks. I will let you know, we typically do it a little bit slower. In my practice for the last 10 years, we typically go at about 12 weeks, especially when there's disc extrusions or very bad disc protrusions, which are both forms of herniations. The time is approximately the same and usually goes anywhere from 20 to 36 visits, just so you know, and that is based on how many levels of disease you have. IDD therapy allows for the controlled distraction of targeted vertebrae to mobilize the joint and create a negative pressure inside the intervertebral disc. Well, if you've been with us, you know that's what we're always trying to create, a negative disc pressure. And we've done lots that we've talked about on intradiscal pressure and positive different intradiscal pressures. If you've been with us at all, or you go back and look at our lives, you're going to see us talk about that. And it's really important to understand positive intradiscal pressures, because the higher that number is, the worse typically the disc is. So what does this do? This does the opposite of this. This creates a vacuum to help suck the material back into the disc, creates a negative pressure, and it's the only thing that does that. Inversion tables won't do this. Hanging from a pull-up bar at your gym will not do this for you as well. Okay, this is the only tool that will do it. The negative pressure leads to the diffusion of fluids and nutrients into the disc. Fluids and nutrients into the disc to stimulate its metabolism and promote healing and hydration. That is everything that you want to have take place if you have degenerative disc disease or facet issues. The negative pressure can lead to the retraction of a herniated nucleus pulposus. It further delivers a passive exercise element to release spasmodic behavior, that's spasms of muscles, and to re-educate supporting tissues. That's a neurosurgeon telling you that. Okay? That's everything that you want to take place. So if you're still suffering with chronic back pain and you know that you have bulging or herniated disc, or you know that the pain is coming from the facet, I highly, highly urge you, if you have not yet, is to do intervertebral spinal decompression therapy. And the beautiful part is that you don't have to find somebody in your community. I've already created a course for you that we're going to be launching in February, and we teach you step by step how to do it. Believe it or not, from the comfort of your home for a fraction of the price that it would cost you to go to a surgeon, and with over an 80% success rate. So we can't wait to share that with you. So that's coming up, so get ready. All right. Can you really do this? Well, yeah, you can. All day long with an over 80% success. This is one of our patients. Here you can see in red, massive disc herniation right there. 12 weeks. And almost totally gone. That's an incredibly hard thing to do, even with surgery and microdiscectomies. In fact, most microdiscectomies I see where they actually go out and cut off this part of the disc don't even look like that on the right-hand side. And you can do that from the comfort of your home with a very high success rate. It's not 100%. It's not a magic wand, okay? But it has a very high success rate when it's done correctly with the proper protocols, with someone that has a lot of experience and certifications, who knows what they're doing to teach you how to do it, all right? So does anybody have any questions I can answer for you? If you do, I would love to answer them for you while we still got a minute or two. I want to thank you as always for being here. Next week, we're going to be talking about another vehicle that will usually be recommended to you or prescribed to you if you're dealing with chronic neck or back pain. And what are the benefits of it, and what are the unfortunate setbacks from doing that or failure rates with it, and do you have other options? So I'm going to be showing you the main vehicles here in the next few weeks of what most people try and unfortunately just really usually don't have great success with. And I want to show you the thing that probably has the highest success rate, and you can do it from your home. And we've worked really hard to create an amazing course that you can follow and do it from the comfort of your home in your own time and still have a really high success rate of getting back to being the parent or the spouse or the coworker or the grandparent that, or whoever, just something for you to get you back to a life where you feel alive again. You feel good. You feel like you can go do the things that you want to do. You can hold your grandchildren without worrying if you're going to drop them. You can go for a hike. You can go on that cruise that you've been thinking about, you thought you'd maybe never be able to do again. You can love your baby again, or your spouse, or just love yourself, and without pain, or with a major reduction in pain, and not be living on narcotic drugs, and not being reliant on having to go get injections and surgeries, infusions. So I want you to know, please don't lose hope. I've seen amazing cases, thousands of them turn around with very high success rates. And that's why I created Disc University, and that's why I created this course, to help people get back to their life without having to do invasive procedures, and to be able to do it from their home, because not everywhere where you live do you have doctors that are nationally certified in this and board certified in it to help you. And so it can sometimes be really challenging, and that's part of my story of why I did this, and I think God wanted me to create this course. So I can't wait to share it with you. So get ready for the launch in February. We're excited to share it with you. It's always a pleasure here. Stephanie, thank you so much. Marisa, thank you so much. I always try to provide great information for you. If you got questions, let me know. Hey, if you like this, you feel like I earned your respect today, please give me a thumbs up. Don't forget to hit that notification bell if you're on YouTube. It lets you know every time I put something out, you get to be first in line to get it. And you know that we do that almost every week, so you don't want to miss that. And I hope you'll share this as well with someone that you know might be suffering, that has no idea that things like this are possible, and to help guide them in their decisions, because a lot of times doctors don't share this. So if you do that, we appreciate it. All right, see you next week, same time, Facebook and YouTube at 1 o'clock. Thank you guys so much. Love and appreciate y'all.